The Naga Hospital Authority Kohima COVID-19 hospital organized its first mock drill and demonstrated on how to handle a COVID-19 positive case patient at the hospital in Nagaland. There have been reports that the safety equipment received by the health workers are substandard. Several complaints have been received regarding the quality of the PPE suits, face masks. Addressing a press briefing, Dr. Sentimerin, Public Information Office in charge ICU NHAK, defended the government, saying that the hospital is getting more equipped with all necessary systems are in place and that the government will not put health workers in danger. Speaking on the preparedness of the NHAK, he stated that 80 to 90% COVID-19 hospital NHAK Kohima has completed its task of preparedness to fight against the pandemic, while 10% remaining is mock drilled and training program that will be conducted on daily basis for all the levels of the NHAK staff, including the sweepers and drivers. He said that every health workers will be given self-precautionary measures on how to maintain and follow the protocol guidelines of do's and don'ts.
Even the government also, on a regular basis, they are changing their protocols. And this is where one of the biggest problems that we are facing. But in the midst of all that, what we intended to do was we wanted to make sure that a system is put in place so that job delegation, responsibility of any kind has to be remembered and has to be participated by the health workers. So that concept of putting in a system, that was where the problem was.
Dr. Sentimerin stated that a total of 32,997 consignment equipment, including all the PPEs, kits, among others, has received so far. The consignments will be received on regular basis from the center and will be distributed to every district. They have enough stock in the hospital with the strength power of 500 members health workers. Dr. Sentimerin clarifying on the manufacture date of the PPEs kit that were used for training process and mock drills by the health workers on COVID-19 preparedness that has been doing the rounds in social media are in fact old stocks brought during the H1N1 outbreak, since the fresh PPEs and masks cannot be used for training purpose alone, he added.
This is the thing that was shown by our health worker. Now this is the mask, and they thought that there is actually a black foam here. A black foam is normally kept here. This foam, because of the duration of the, it fell off, and they thought that this was fungus. So this was where actually we thought we were having trouble. And this whole thing was actually obtained during the time of H1N1. And this was given to us recently, but this we wanted to use it for mock drills, not for patients.
During the site visitations of the NHAK preparedness on action plan of the COVID-19, Dr. Sentimerin stated that when 50% bed strength, 20 beds from the Chedama COVID-19 hospital is filled up with COVID positive patients, only after that NHAK COVID hospital shall be put on red alert.
We have around 20 beds ICU, and if required, the SNCU, that other room, will also be converted into an ICU. So we can entertain around 20 beds of serious patients.
While Dr. Thong, while highlighting their action plan on identifying their activities, he said that in the event of the exhaustions of the available health care workers, manpower shall be requisitioned from other unaffected districts as deemed fit by the Department of Health and Family Welfare. Daily informations on regular reports and cumulative update boards also have been set up. The NHK hospital is equipped with 67 beds, 44 for male and 23 for female, 20 ICU stations and 9 ventilators to treat COVID-19 patients. For the safety of the health workers, authorities claim that they have 2,055 of the PPEs, 1,100 of the N95 masks, 2,600 of the FFP3, 12,300 pieces of the triple layer mask, 10 infra thermometer, 11,700 non-sterilized gloves, 1,000 pairs of the sterilized glove, 1,180 bottles of the hand sanitizers, 500 liters of the sodium hypochlorite, 20 liters of the SITI, 10 IV stands, 85 pillows, 85 blankets, 250 bed sheets and 100 hand towels. With Inzan Bemukuvung,